Hi, I'm Lori Handy. I'm the Associate Director of the Vaccine Education Center at CHOP and a pediatric infectious disease physician. Sure. Well, I think that the first thing that's a really great opportunity for providers is to recognize that going back to school or starting school for a kindergartner is a new opportunity to talk about vaccines a little bit differently. It's the chance to say, I know we've had these conversations before, but I'm thinking differently about the risk for your child going back to school. Can we jump back into those conversations? So it is a really nice time to kind of recenter on your child's doing something new in their life, and let's make sure they're protected while they do that. Beyond that, I think then we kind of make sure that we're following some of our general best practices, which is to make sure the family knows how strongly we recommend a vaccine. It's important to have a conversation, but to lead into that conversation, saying, I really strongly recommend that your child gets this vaccine before school to keep them protected from infections like whooping cough or pneumonia or chicken pox. And you'll notice in there I'm naming the infection, right? The thing that the child could get sick with, not really going to alphabet soup of, make sure we're up on our DTaP because those alphabet soup vaccine names don't mean that much to families. And then finally, use that time for listening to recognize what questions does the family have now? What have they heard recently? What do they want to talk about? Because if we don't address their biggest question, we can kind of do all the talking in the world, but we have to really focus on what they want to know about. Yeah, the thing I like to remind people is it's not just our families living this environment, we're living in it, right? So I'm wondering, like, should I use a Teflon pan or not? We're all wondering all of these things that we're hearing online. And so it's really, really normal that the parents come in and ask these questions that, maybe in our mind we think we should know the right answer to that, or the family should. But in the family's mind, they're really just curious. They've seen a lot. They've done some work to try to get answer to their questions because maybe it's been a year since they've had an appointment with a healthcare provider. And when they've done that work, they feel really proud of that information, right? They went out there, they took the time, they looked something up to really try and make things better for their kids. So just recognize, that information seeking comes from a really good place. Uh, that being said, if a family comes in and they either have an idea that's not really grounded in science, or maybe are just asking a question where there's a really clear, correct answer in terms of how to keep kids healthy, I'll usually say something like, a lot of families have asked me that, or I wondered that myself. At least recognizing that's a thing out there that people hear and talk about. But then make sure you're able to transition into saying, I heard that so much, I kind of did a little more digging myself. Can I share what I found? Because you can then help the family realize there's a whole world of other information that might help with this conversation. And, if they're coming to you and engaging with this topic, it's because they trust you. It's because they want to engage with you. They're not coming in to say, I heard this thing, don't talk to me. Because they're there. They're in the office with you. So kind of take that opportunity to just get them to useful resources. The final thing I'll say, which is, a bit divergent from where we've been in the past, is if you have a family that very much says, I get my healthcare information from TikTok or Instagram or some other social media platform, that's okay. We just have to help them find some more accounts that get them good information. So, many providers are eager to say, like, that's not the place you want to go. Let me give you this great website, or let me give you this good handout. If the family doesn't like handouts, don't give them a handout. Give them information in the form they want it. And at the Vaccine Education Center, we're trying to collate more, like, what are more of those reliable sources? Because there's people out there, and we really can get people the information in the place that they want it.